far spacious skies, far amber waves of grain, far purple.
We Americans recently celebrated the 70th anniversary of a turning point in world history. To this day, the D-Day invasion of Europe is a symbol of our resolve to assure the national security and values of the United States. We have another anniversary of equal importance to celebrate in 2015, one commemorating an equally important event for the security of American families. On August 14, 1935, President Franklin D. Roosevelt signed the Social Security Act. The foundation of domestic policy for the past 80 years, Social Security has evolved under presidents and congressional majorities of both major political parties to help American families of all classes, races, religions, and political persuasions in times of need. We are all familiar with Social Security pensions paid to retired and disabled workers and their families. Currently providing basic incomes to 55 million, or roughly 1 in 6 Americans, these pensions have played a decisive role in reducing the poverty rate among seniors from about 35% in 1960 to under 9% today. Remarkable in itself, this is nothing short of astonishing when one considers that the number of older people has increased 4-fold in the years since Social Security became the law of the land. From its inception, Social Security has been about much more than the federal pensions we typically associate with those two words, Social Security. Enacted during the Great Depression of the 1930s, Social Security was intended to address hardship from a variety of sources. In his 1935 message to Congress, President Roosevelt urged placing, quote, the security of the men, women, and children of the nation first. Elaborating on the rationale for these sweeping reforms, Labor Secretary Francis Perkins said, quote, we have come to learn that the large majority of our citizens must have protection against the loss of income due to unemployment, old age, death of the breadwinners, and disabling accident and illness, not only on humanitarian grounds, but in the interest of our national welfare. With that in mind, the original Social Security Act aimed to help people meet the basic needs of food, clothing, shelter, and health care. It did this through 3 major types of assistance: pensions for those unable to work, incomes for those temporarily displaced from employment, and help in meeting basic health needs. Old age pensions under Titles I and II, and grants to the states for unemployment compensation, aid to dependent children, maternal and child welfare, public health, and aid to the blind under Titles III through X were all parts of the original Social Security Act. As the economy evolved and American prosperity grew, leaders from both political parties initiated adjustments to Social Security in response to changing times. During the 1960s, President Lyndon Johnson proposed and Congress enacted Medicare to provide health insurance to older and disabled Americans, and Medicaid to cover medical costs for low-income families. Several years later, President Richard Nixon proposed and Congress approved Supplemental Security Income, or SSI, which provides basic incomes for people with disabilities. Several years later, they created new block grants to the states for social services. This legislation, Title 20 of the Social Security Act, expanded health and social services that prevent, reduce, or eliminate dependency. In 1996, a bipartisan welfare reform initiative replaced Social Security's Aid to Families with Dependent Children program with the Temporary Assistance to Needy Families program under Title 4A. TANF, as it is called, established lifetime limits on the duration of cash assistance or welfare. The following year, the State Child Health Insurance Program, or SCHIP, was adopted by a bipartisan Congress as Title 21 of the Social Security Act, partnering with the states to provide health care to tens of millions of uninsured children from working families. More recently, in the wake of the 2008 Great Recession, Congress extended the duration of unemployment compensation benefits under Title III of the Social Security Act, helping millions of American families meet basic needs during a deep and prolonged economic downturn. And in the Affordable Care Act, Congress expanded health benefits under Title XIX, or Medicaid. Covering families with employed but uninsured parents, a family of four with earnings of up to $33,400 can now get health care benefits through Medicaid, but only in those states that have approved the expansion. Depending on the state of the economy, on any given day, more than 4 in 10 Americans are receiving some form of support from Social Security. The vast majority are from families of workers, retirees, people with disabilities, or the temporarily unemployed. Over 1/3 of Americans get health insurance through the provisions of the Social Security Act, and virtually all of us who live to retirement age will eventually receive a return on our investments. Through payroll taxes for pension and Medicare benefits, and federal income taxes that most of us pay, we, the American people, make all of this possible. Considered in that light, Social Security is not something that the government does for us. Rather, it is something that we as Americans do for one another through our national and state governments, contributing through our tax dollars when we have the means, and receiving benefits at those points in our lives when we need them. How ingrained is Social Security in American society today? Consider this. Over 450 million Social Security cards have been issued since 1935. No American under age 80 has been alive during an era that did not have Social Security. Along with a handful of other basic need programs, the GI Bill, public housing, and supplemental nutrition or food stamps, Social Security is the foundation of the 2,100+ domestic programs of the federal government. Social Security programs help meet basic needs in every state, stabilizing families, communities, and regional economies. For example, at the peak of the Great Recession, unemployment compensation recipients reached higher proportions in the industrial Midwest and Far West. On the other hand, states in the south-central region of the country have relatively higher concentrations of people receiving disability benefits. Even prior to the Medicaid expansion in the Affordable Care Act, those covered by Medicaid were larger proportions of the populations in the states of the West, East, and parts of the Midwest, and much of the South. And generally speaking, concentrations of retirees receiving Social Security pensions and Medicare are greater in states east of the Mississippi. Social Security is one of the things that binds together a nation that is increasingly diverse, ethnically, linguistically, religiously, and racially. It is one of the things that connects our national and state governments in serving us, the American people. It is one of the things worth having a national security apparatus to protect. Social Security is to our relationships with one another and communities spanning our enormous country what national security is to our relationships with other countries. Its 80th anniversary, on August 14, 2015, is well worth a day of national celebration and reflection on President Roosevelt's commitment to place, quote, the security of the men, women, and children of the nation first. It reminds us of the commitment to one another that we share as Americans, and is an opportunity to reflect on what we can do to keep Social Security, in all of its forms, strong for future generations.